Good morning, everyone. I'm Joe Mountain. I'm a dental director of Family First Health. 12 years ago, when I finished my residency, my primary financial goal was to have a stable income. With that, my hope was that a stable income would allow for me to take care of my family, begin planning for retirement, and also start repayment on my student loans. Student loans, for me, my debt was high, but the loan repayment programs, I saw those as a perk. That wasn't a great motivator for me to choose an employer. I felt it was more important to choose the correct employer, so that's where I put my time. That's why I invested my time. When I interviewed at Family First Health, that interview was the most impressive. They were able to explain to me why they needed a dentist with my skill set. They were able to communicate what the productivity expectations were, and the compensation was generous. Based on my goals and what working in the FQHC had to offer, that was the best financial decision for me.
Right. Relationships is next. Several of our respondents worked in both private practice and public health, and they report that they feel there are deeper relationships in the public health arena. There are close associations with other professionals, including pediatricians. They feel that they're keeping people out of the ER. There's a shared vision and commitment among the staff that they work with, and they feel patients are more appreciative. Joe, how's your experience been there?
Well, relationships, I value relationships. So working in the FQHC was a great fit for me. My work allows for me to work very closely with medical providers, administrators, and also my dental colleagues. The relationship I have with my patients is very unique. My patients are great. They're a very diverse group of people. They appreciate what I have to offer, and I feel like I understand their needs. The thing that I'm very optimistic about with the group of providers that we have in our practice we have 10 dentists, 2 hygienists, is that they all are very open-minded to working in a group practice. I think that is something that is changing over the years, but the group we have now, they are seeking out group practices.
On to the personal rewards. There's a strong sense of satisfaction. There's an ability to focus on the craft rather than administrative responsibilities when they're in a community setting or FQHC. They feel that the respondents to our survey felt that they make a huge difference in their patients' lives, not just making, whitening teeth or whatever, but that there's some psychological well-being, things that Mike Brunell discussed earlier. They can see an impact from one generation to the next, where one generation may be losing their teeth at age 25, but the next generation is coming up. They also tend to go into an area that's similar to where they grew up, which they perceive as having a high quality of life. It's something that they're used to. I think that probably has some implications for college admissions in terms of having an impact on where dentists are practicing. So, Joe, what were your reasons for going into an underserved area?
Well, for this category, I do have those administrative responsibilities, so, but I enjoy that. So that was actually something that attracted me to the job. This category, I kind of divided it into personal and professional needs. Professionally, I needed to work for an employer that had great respect in the community. I felt as if that aligned with what I wanted ethically. Personally, I needed to live in a community that was affordable, it was safe, a community that my family could navigate socially. Those things led me to Family First Health, which led me to work in an underserved area. I was open-minded, whether I would work in a rural area or urban area, but I do think your research kind of tells us something a little bit different.